We'll get started. I'll let you, yes. Did everybody get one of those?
Yeah.
Perfect. All right, well, my name's Schreiner, and I'm from SCC, and I'm a health professions recruiter. And today I'm going to talk about the paramedic program and the EMT program, okay? At any time, I'm pretty informal, okay? So at any time, if you have a question, please just raise your hand. No question's a dumb question. I'd rather answer it while I'm here. But you can always reach out to me anytime. Before you leave today, you can take one of my business cards. It's a sticker, so you can just stick it on something. It's got my email, my number, so if you have any questions. Or if you decide, hey, I'm interested in health field, but I'm not sure if I want to do something in public safety, along with paramedic EMT, feel free to contact me. I'm happy to go over all the other programs that we have. Because SCC does provide a lot of health programs, but today I'm just going to talk about the EMT and paramedic programs. Hello, welcome.
Hello.
Is everybody getting the papers okay? Can everybody hear me? I mean, I'm pretty loud, so, okay, I just want to make sure. So, if I talk too fast, let me know, okay? I'm a fast talker, and to be like, Kara, well, slow down, all right? Because I'd rather you get the information and get it correctly. We're also going to do some hands-on activities today. That's cool. And then I brought snacks. I know I like to eat, so I brought you some food. I hope that's all right. So make sure you get some food before you leave as well, okay? All right, so we're going to talk about, we'll get the formal stuff over with first, and then we'll talk about some of the other cool things. But yes, we do have one of the top paramedic programs, okay, around. And I think that just contributes to our amazing instructors and faculty and professors that we have. We also have state-of-the-art facilities. Has anybody been able to come to our West Burlington campus ever and see our ambulance? No? All right, well, we're gonna have to have a field trip, okay, sometime. You guys are gonna have to come out. We have a fully working simulator ambulance, which basically means it can do everything a normal ambulance does. It just can't drive away. It's an actual functional ambulance. So the lights work, the oxygen works, all the buttons and gadgets that you would need to become an EMT and paramedic. So I think that really has kind of put us forward on a lot of advancements because you actually learn on the equipment that you would use out in the real field. So technically, you're riding an ambulance like from day one, okay? Now for a driving ambulance, it's within a few weeks to a month, depending you're right in, okay? We get you right into the workforce, right into that hands-on experience so you can start, okay? It's realistic. SCC's done a really good job about taking away the fluff courses, as I call them. Those courses are courses that you just are never gonna use, okay? You really have the bare minimum that you need, and so you get school faster, through it faster and cheaper, and you get to do hands-on. So you're not just sitting in a classroom, okay? The EMT and paramedic programs, you'll never, ever be bored. They are never just sitting. They might be sitting for a few minutes to get a little lecture, but they are always up working on equipment, working on the ambulance, working on our simulators and our dummies that we use. And so they're always doing hands-on. So I think that's what's great about it is you're getting that one-on-one experience, okay? You'll see some things at our school, like they've carried me down the stairway, okay, because there's emergencies in all arounds, right? So they've carried me down the stairway. I think that one's probably my scariest one, actually. I'm like, don't drop me, but they haven't yet, okay? We have a full apartment set up because a lot of your emergencies, do you guys know how like close emergencies usually are to your home? How many miles? How many miles? What's the average emergency close to your home? How many miles do you think? Close. It's a mile or less. That's usually where most emergencies happen. Very sad, okay? So we have all that. We have car crash scenes, okay? Yes, we actually topple over things. There's glass. It's very realistic, okay? You're pulling out a dummy, which is just as heavy as a regular person, and you're having to perform life-saving measures. We have an apartment. You might have to break a window to go through, okay? The door might be blocked. You might have to call the firefighters, okay? You learn all of that. So something in EMT and paramedics you might see, they always carry radios, right? I couldn't bring today because they're actually using them, otherwise I would have brought one. But you start learning the radios and the frequencies and how you communicate through those, okay? So very realistic. The other things we do is, since we have all different health programs, and for example, the nursing program, a lot of times when you get to the hospital after you've taken care of the patient, right, you gotta hand them off to the nurse and the doctor. You actually do that at SCC, okay? You actually hand them off, you give report is how we call it, and again, it's just as realistic as possible. I would say that the paramedic and EMT students probably have some of the most fun. Don't tell the other programs, but they do, okay? It's not that we don't take this seriously, but the instructors do a really good job since they're dealing so much with life and death. You know, they do try to make it fun and incorporate different things, okay? I'll also say during graduation, it's the biggest group. It is an amazing thing to see. The police come, paramedics come, EMT comes, firefighters come, all public safety, and all the trucks and everybody are lined up and they're all in uniform, and it's just, I mean, it's just amazing about the support you have. So something that I really stress, if you are looking for a career that you are gonna have a lifelong family and friends, EMT and paramedic are the way to go, okay? Because it's a brotherhood, it's a sisterhood, and you know, you're in it together. Does anybody have any questions so far about any of like our facilities or kind of things? Does it kind of sound cool? Yeah? Yeah? Do you want to come out and see our ambulance sometime and our simulators? Okay, well, do a field trip. So, write on your paper somewhere, November 7th, okay? And I will make sure that your instructor gets this. It should be out within a week or two. We're having a health expo, okay? And that will include the paramedic and EMT program, and you're gonna actually get a lot of more hands-on activity that day. My health expos aren't just you come out and you get talked to. You're gonna actually come out and do the work, okay? You're gonna dive right in, okay? That's paramedic, EMT, nursing, respiratory, all of those. So you get to have a chance that day. So I hope y'all will be able to make that. It's free to you. I have lots of vendors. You get a lot of free stuff, okay? You get a bag, and by the end of it, the bag's filled, okay? And so it's just an extra support for you. So those types of opportunities. And if that doesn't work, hopefully we can make a field trip day. You guys can come out and you can go into the ambulance. Because that's something too that we like to do. When you guys come visit, we like to get you in the equipment, okay? It's no fun just looking at it. I mean, it's cool to see, it's pretty cool, but we like to get you in, you step up into the ambulance, you get to tour around and all that stuff, so. All right, so I'm gonna start with the purple page real quick so we get some of the paperwork out of the way. We have different levels. So we have the paramedic program, which is like the most advanced, okay? But what you have to start with before you can become a paramedic is an EMT, okay? Is anybody an EMT now or working on their EMT? No, not yet? Okay. Did you know you can do this in high school? Okay, you can do this in high school, okay? You can start on the program. It's a 1 semester EMT program. We offer it all the time. So it's a 1 semester certificate. It's your basics, okay? It's your foundation. So this is why anybody who becomes a paramedic has to go through the EMT program, because if you don't have that foundation, then you're not gonna be able to be an excellent paramedic. And that's something we strive for. We don't just do good is good enough in our health programs, especially our paramedic program, because you're saving lives. We want you to be excellent, okay? And our students have really exceeded expectations. Our testing is beyond expectations. We really do have a quality state-of-the-art program. So you can start this now, okay? Again, it's a semester, 7 credits, and you're done, okay? You could then be an EMT. Now, you're probably like thinking, okay, well, what's the difference between EMT and paramedic then, right? Does anybody know maybe what the difference is? Anybody want to take a guess? No wrong answer. No wrong answer. Okay, well, I'll tell you the difference. The difference is how skilled. So EMTs cannot start IVs, okay? They cannot give medications, and that includes injections, okay? And they also, they can't fully do the full intubating, okay? So they basically do basic CPR and basic first aid. And they're the ones that are gonna make sure you're continuing to breathe before the paramedic gets there and might have to give you medications or other life-saving measures, okay? So, does anybody know CPR? Is anybody certified in CPR besides us? No? Okay. That is a good first step. You are? Oh, you are? Yeah, perfect, wonderful. That's excellent, cool. So CPR, okay, that is where we're doing the rescue breathing and then also the chest compressions. We're actually gonna do a little CPR and rescue breaths on our baby here in a little bit, just so you can get a feel for it. That is something that's a basic life-saving measure, and that's what EMTs do. The other thing that EMTs do that's super important is scene safety, okay? So a lot of times when someone's hurt, a lot of people like to run up to the scenario, but they don't look, okay? And so that's one of the first things you look is your scene. Is it safe? Is there electrical lines on the ground? Am I gonna electrocute it? Is there glass? Is there fire? Is there other vehicles that might hit me as I run out into the street, okay? So that's something that we teach our students, scene safety, because if you're not safe, how can you save a life, right? The EMTs, they make sure that the scene is safe and everything is clear, okay? That is also, they would be the ones, if you're in the car and you've had a wreck and you wanna get out, but there's electrical lines down, they would shout at you, don't get out of your car, okay? Yes, it's true. If you get out your car and there's down electrical lines and they're on the ground attached to your vehicle, you will get electrocuted, okay? So safety, 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 okay? Any questions about the EMT program? So this is your first step. You wanna write first step to becoming a paramedic. You have to be an EMT. All right, the other two are paramedic certificate and your paramedic AAS, which is your associates. Kara, what's the big difference? You're gonna go to school a little bit longer with your associate's degree, but we hardly have anybody, even though I brought the paramedic certificate, we don't have very many people do the paramedic certificate because as a paramedic, you get paid more if you do your associates, okay? And the more schooling you have, the better pay. You're also more qualified. So we do push, even though both are offered, a lot of our students get the AA, okay, S, your associates with your paramedic. But it's not required, okay? But sometimes our paramedic students want to end up becoming a nurse, and then they want to work on like our flights. So they get on the helicopter, okay? So med force. And so they have to be a paramedic with their AAS, and then they have to get their nursing degree, and then they can be on med force, okay? So there's a lot of different options and avenues becoming a paramedic. You could eventually become a firefighter on top of it, okay? If you were a paramedic. The paramedic program after the EMT program altogether is 2 years, okay? It's 2 years, you make great money afterwards, and then you have a career for life. All of these programs, you can start the prereqs through high school, okay? So a lot of them, Essentials of Anatomy and Physiology, concurrent enrollment is what it's called. Rachel Boyd is actually the high school student advocate here. And so Intro to Computers is offers, medical terminology, math applications, Intro to Psych. All these courses you can have BHS pay for you, okay? And you can get credit in high school and credit in college, okay? So start looking at that. I didn't do that in high school. It wasn't really pushed, and I think they offered like English, because I'm a lot older than you guys, and but it would have been nice to have a college course paid for because college is expensive. Yes.
I'm sorry. How long is that program again?
So the paramedic program is 2 full years. 2 full years. And I'll tell you, it goes really fast for them because they're constantly on the move, okay? If you have a lot of energy, okay, if I always say too, if you're a student who likes adrenaline, if you're an adrenaline junkie, this is a program for you, okay? It is fun, but it's also serious because you're saving people's lives and you get out in the field immediately. Does anybody have any questions about that? Am I doing okay on time? Yeah. Okay, so I want to talk a little bit about what paramedics do a little bit more, okay? So they don't just come up and give rescue breaths, okay? They're giving injections, they're starting IVs, they're drilling into your bone to start an IV if they need to. Yes, on our simulators, okay, which are like robots. So let me explain a little, let me go back. Sometimes we talk about having a dummy okay? And then we have a simulator. So dummies are basically mannequins that can maybe do one thing, or they just don't do anything, they just lay there, okay? Simulators are robots, okay? And our simulators can do everything a normal human's doing, everything you're doing right now, except get up and walk away. Did you know that? That's what we have at SCC. They can blink, they can talk, they breathe, they bleed, okay? They have pulses, they can vomit, okay? They can have diarrhea, they can urinate. So our simulators at SCC are that advanced. They just can't get up and walk away, okay? Do they have simulators and robots like that? Of course they do. They're millions and billions of dollars. We don't have that. But at SCC, we have millions of dollars worth of technology. So you get the one-on-one advanced training, okay? So when I say you're working on a simulator, you're truly working on something that is as lifelike as possible. So you'll go into a scenario, we make them as realistic as possible. You go into a scenario and let's say you're dealing with someone who has a burn today, okay? You're gonna go in and you're gonna see their body burned, okay? That simulator, that robot is gonna look burned. It's gonna smell like it's been burnt, okay? Why do we do that? Why do you think we do that for you? Why would we do that? I see some of you are like, oh my gosh. Why would we do that? Why would we make it so real?
If it actually happens, like you had the experience of like what it should expect and like what it should smell like and stuff.
Exactly, and that's what sets SCC apart from any other program. We prepare you for every scenario as realistic as possible. And so our students are known when they come up to an emergency, they're cool, calm, collected, and they truly save the life, okay? Other scenarios you might see, a bike accident, a car accident, okay? We have done, and we do all ages. So we have simulators, we have baby simulators that actually will breathe. This one doesn't, this is Molly. She doesn't breathe or cry or anything, but we actually have a baby simulator that breathes and cries, okay? We have a simulator that gives birth, okay? She actually gives birth to a baby, okay? A little simulator baby, and it's about 7 pounds, so it's pretty realistic. And sometimes with births, things go wrong, so you be trained as a paramedic in case that birth goes wrong. Because I don't know if anybody's watched 911. Has anybody watched 911? Some of you? Some of the emergency shows? It's true that they sometimes have to deliver babies, and then sometimes there's complications. So the paramedic students work very closely with our nursing department on what possibly could happen for complications so that baby's okay and the mommy's okay, all right? We have a sim junior. He's a little boy, okay? Between ages of 7 and 9. He can also turn into a female, and so we do scenarios with children. We also do scenarios with family, okay? Because a lot of times on emergency, there's family members, there's friends, okay? And I don't know how many times I've had to, when I've saved somebody, I've had to pick up and move the family member, okay? When someone's not breathing, it's a very hysterical and scary time. A lot of times what we deal with in emergency situations the most is the family, trying to get them out of the way so we can save the person that's down on the ground, okay? Now we do that respectfully. We don't have to say move, okay? But sometimes we do have to help them move out of the way. Because when there's emergency response, some people can be frozen, some people can be screaming hysterically, some people are shouting, okay? And so you're trained in that as well to deal with the family members and the people around. Sometimes we get a lot of spectators, and I'm sure your instructor can talk about that too on emergencies. We get a lot of spectators, okay? Right now everybody's got their phones, right? So click, click, click. It's not a time to have a whole bunch of people around, especially in an emergency situation. We gotta get to that person, that victim, and help them out, all right? So we have those scenarios, and then we have an adult, and our adult is the most advanced, and you'll see him all over. His name's Sin Man, but he can become a female or male, okay? And we put him in different scenarios. So usually he's with the car crash, the bicycle accident. Sometimes we've had a fall. So, and we let our students around know, like, hey, there's a scenario, don't worry, there's gonna be a scenario today. Sometimes we have live volunteers. If you like to act, we're always looking for actors. You could do that now in high school. You can come be one of my actors. We put fake makeup on you, okay? It's called moulage. It's a special effects makeup, and you get to be an actor for the day, okay? That might be something where you're screaming. It might be something you're laying down. It might be something you're crying because we've placed maybe like you've got a broken bone. Yes, it looks realistic. We actually have props, and it looks like your bone is sticking out, okay? So you can do all of those things now while you're in high school. And I encourage that because it gives you more one-on-one, and you get to meet the instructors. Any questions? Am I freaking you out? No? Maybe a few of you. Okay. There's a lot of information. Does anybody have any questions about the paramedic program? So how many years is the paramedic program? How many? 2. Perfect. Do you have to become an EMT first? Yes. Okay. Can you take courses now in high school? Yes. Perfect. You guys are doing great. Okay. Anybody have any questions? Yes.
What are the requirements to enter?
Perfect. So, if we go to our blue page, okay, the requirements to enter the program are all, okay, so actually, you can take some of these, but they're not now required. I forgot they took those prereqs. So, for the requirements to enter the program, you have to have your CPR certification, and that would actually be on the front page. Sorry, I told you the wrong. Right here on the front page, you have to have your CPR certification, and you have to have your EMT, your EMT program done, okay? So you need to have the EMT certificate, and you gotta be CPR certified. Any questions there? Did we get your questions answered? Yeah? Yes?
When do you start riding in the ambulance?
You start riding in the ambulance, like the one that actually drives. So depending on the clinical, but it's within a month of the program. Because it's just a semester long. So even I would say 2 weeks to 4 weeks. That's probably the best. But our simulator ambulance you get right in. But an actual driving, moving ambulance is 2 to 4 weeks. So it's immediate, okay? And when you're not in that ambulance, you're in hands-on using all of our state-of-the-art technology, okay? So we use everything that would be current for this area, surrounding area, Missouri, Illinois. It's very versatile and universal equipment. So if you decided to move to California, you would be able to do your job in California. Does that make sense?
What agencies do they ride with?
They ride with the Great River, which is Southeast Iowa Regional Medical Center. And then they do it's Southeast Regional as well. They ride with Lee County, which is like Fort Madison and Keokuk area down there. And then they also go across into Quokka and Nauvoo. I can't remember the county off my head. But every ambulance looks similar, but there's still differences. Some are a little bigger, some are smaller. So you really do get in with all the different ambulances to get that experience in those rides. They also could get a tour with MedForce, which is the helicopter that's closest to here. And in case you wanted to further on and maybe become a nurse and a paramedic, you have to be both to become to do MedForce, which is the helicopters. Great questions. Any other questions? No? Okay, all right. Okay, so I brought Molly today. I'm sorry I couldn't bring dummies for everybody to use because our students are in class today and they're using all of them. But I did bring Molly, and I'm gonna go over her a little bit and the equipment that I brought, and then I would like you to, if you feel comfortable, you're not gonna hurt her, okay? And this is why we use them, and this is why we use our simulator robots, because we want you to make mistakes on the actual dummy or robot and not a real person, right? So that's also a great thing about our program is you can feel comfortable practicing, learn the correct skill, and then when you do it on a real person, you know, because it's a lot of the same. So what Molly can do is she can do rescue breaths, and these are the old CPR. We used to use these, but now our CPR babies that we train on, okay, they actually have lights, and it actually shows if you're doing the correct compressions. The American Heart Association decided that it wasn't a great evaluator of whether we're doing deep enough compressions or not, okay? There is a difference on how we're doing rescue breaths with an adult or child compared to an infant, okay? And so with this, okay, we are going to use what's called an ambu bag, okay? And a lot of times I see people, they think we do this, and when you watch those shows, okay, on TV, they're like, some of them are really squeezing. That would actually pop the baby's lungs. They're like a balloon, okay? It's a gentle, that's right, it's a gentle. Part of that is you don't need that much because it's getting enough air, and also if we did this, I'm tired, okay? And you have to do a lot of these. And so if the rescuer tires out, then how can they save the life, right? So the medical equipment actually, you see a lot of force and aggression with all this stuff. You don't have to be that aggressive with medical equipment. It is made for easy use, so you don't have to put as much effort, so you don't get so tired. Does that make sense? Yeah. So today when we're doing rescue breaths, we're gonna do it gentle. It's just like this. It is calm, cool, collected. Okay, we're a chill vibe. We do not want to be like this. Okay, my hand hurts from doing that. All right. So this is the ambu bag. Okay, and this is our rescue mouth. Okay, mask. It looks like a little pear, as I call it. Okay, or you can say triangle. I've heard it both ways. But with this, the tip, okay, of the pear goes over the nose and the mouth for the baby. Okay. If we were doing this on a child or an adult, it would just go over the mouth. But since the area is so small, you have to be sure that you have a seal over both. So the mask is actually going to go over her mouth and nose, and then we're going to give her a small squeeze, and then that will cause for her lungs to rise. The other thing that we do is we make sure we do a head chin tilt. Okay. Why do we do that? Why would I want your neck back when you're laying on the ground?
Open your esophagus.
That's right. Open your esophagus, your trachea, your airway. Okay, it opens it all up. Okay. Otherwise, it's closed. Okay, and then we can't get air through there. Well, if you don't get air, then that's a problem, right? So we always want to make sure that the head's up, and that way it opens everything up to receive the rescue breath that we're giving. Okay. So I'm gonna show you real quick, and then I will also pass this around. But please try. You're not gonna hurt her, okay? This is why I brought her. I'm gonna take her little necklace off so it doesn't get in the way. Also with this, we have, you can kind of hear, everybody, right? That's me giving chest compressions, okay? That's the only way we used to be able to like accurately know if you're giving the right ones. There's a couple different ways you can give chest compressions for babies. You can do a 2 thumb, and we're not gonna get too critical on the technical skills today. No, nobody's getting tested here, okay, or graded. You can do 2 thumbs, or you can do, oh, we lost her. We'll just put that back over there too. Or you can do 2 fingers, okay? And it's not, we're not doing this, okay? This would break Molly's ribs, okay? Yes, on adults, it is common to sometimes break a rib, okay? Well, we don't want to break any ribs for babies. That will puncture the lungs and they will not survive, okay? So with Molly, we are gentle compressions, okay? Just like we're gentle giving rescue breaths. Anybody have questions? Are you excited?
Yeah.
Hopefully. Okay. Can everybody see if I stand right here real quick? So if you just want to take her, put her head back, and then you're going to gently with a C, gently press. Now, truly, like you see on some shows, they seem to press down really hard. That would break the baby's face then. We don't want to be that tough, okay? Not rough, okay? And so we're just going to do our head chin tilt lift, okay? And then we're going to do just a little bit of holding this down. Give a nice little squeeze. And as you can see, y'all can come closer to me. You can see her lungs going up and down. And that's success. We're helping Molly stay alive. Pretty cool? All right, guess what? You can try first. All right, so I'll pass that around, all right? Why we're doing that, so y'all also have hands on, I think I'll pass the snacks around. Is that all right? Is that cool? Okay. So I have an assortment, okay, and I have plenty. I've got, if you want a sucker, okay, there's some chips, there's gummies in here, I think there's Rice Krispie treats. Please just take one, okay, and pass it around. But I brought an assortment because I didn't know what everybody liked. So please take one and pass it around, all right? Pass it around. You done? Did you get to do it? Did you do it? You got this. Yep. There you go. You did it. Good job. That's it. A lot of times people think CPR so hard. It really is not. Yeah. That's right. Keep only alive. Has anybody thought about the paramedic program? Does anybody like, yeah, a little bit? Yeah, I can see you being a paramedic. Yeah. You wanna be a firefighter? That's also a good career. Perfect. Is anybody else thinking of anything else? I mean, it's okay if it's not health. You guys know what you wanna do, yes? No? You do? What do you wanna do? You wanna be what? Oh, cool. Wonderful. Excellent. I can't like water. Yep. Wonderful. Anybody else want to share? No? Yeah. Okay. So, also, I love my job. I guess I didn't really tell you about myself. So why everybody's doing this? Hey, if I get your attention for just a moment, thank you. I'm glad everybody's excited. But I'm gonna pass out, if you like one, it's my business card. It's also a sticker, okay? So you can peel it off, put it somewhere so you don't lose it. But I should probably tell you a little about myself. So I've been in healthcare now for 20 years, okay? And I started in high school. That's where my career started. I started when we had medical records down in the dungeon in the basement, okay? And I worked my way up, okay? And started working in different areas and getting my certificates and my training, my degrees in different areas of medical. Then I became a teacher, and then now I'm on the health recruiter side, okay? So my main purpose of my job, okay, is to help you. So whether if you know you want to go into healthcare or not, okay, or if you want to go into something else, if you email me, I will try to help you narrow that down. Or if you're like, hey, Kara, I really know what I want to do, great, let's get you started on courses. Did you know that SCC offers free job shadows to you guys for any field? Any field we have around here. You can go to a job shadow for free. So email me, okay, and let me know. So anybody want some of these? Anybody want one of these? Anybody else want one? You can come get one at the end of class. Perfect. Pass around snacks, good. Okay, snacks are always good. Is everybody getting snacks? Did everybody get snacks? So I'll talk a little bit about the rack card. It's a good just like one-stop shop. It's got what you're gonna get for starter pay, roughly around tier 54. It could be a little higher, okay, depending, but that's an average salary to start off with. That's pretty decent for a 2-year program. Some of our medical personnel, our students out of a 2-year program, they start out, thank you, at $60,000+, okay? So if you're like, Kara, this is great, because I also understand, but I want to make a little more money, okay? Then I would look into respiratory therapy, I would look into nursing, or if you like technology and computers and fixing things, I would look into healthcare information technology. One of our guys after a 2-year degree is now at Mayo's Health Center and is making $100,000 a year. He has an AA. That's a lot of money for an AA, okay? We also have funding at SCC, which I think also helps our students. I always tell students, if you're willing to fill out some paperwork and we're willing to help you fill the paperwork, I'm gonna take the baby. There's a lot of scholarships, so there's a potential for you to go into programs and go completely free. That's been never heard of, okay? And SCC does try to offer a lot of opportunities for you not to have a debt at the end, okay? So really start thinking about those things. Did I cover everything? Is there anything else you want me to cover? Okay, we're getting close to time, right? We got a little bit of time, 55? Okay. Does anybody have any questions for me? No questions, a dumb question. Please ask, that's why I'm here. We have students from all over that come to our paramedic program, okay? And we offer it, you can do it. And we offer it at all times, okay? So you really can get through the program and within 2 years you have a successful career. Yes?
So is it just one program or is it 3 different programs?
Technically it's 2, but there's 2 different avenues for the paramedic. And I say there's 2 because you have to have your EMT. But do they count it as all one at the end? Yes, they do.
Okay, so I can just take on to
Yeah, if you don't want to have their certificate, but you want to stay with the AA, yeah, I mean, you wouldn't take the white paper. Otherwise, if you want their certificate and you don't want the associate's degree with it, then, again, the associate's degree gives you a little more money, okay? It is, you know, it's not that you wouldn't have a job with your certificate either, but if it's really something that you want to continue your education, maybe become a firefighter on top of being a paramedic, because a lot of our areas are rural areas. We don't have ambulance services in a lot of our areas surrounding. Did you guys know that? So we have to pull our ambulances from here down in Lee County. Lee County right now, because we lost the hospital in Keokuk, Lee County is serving a huge area. So this is why it's so critical for people to even get their CPR in a community, because the ambulance might take 20 minutes to get there. We hope not, but worst case scenario, it could take 20 minutes, and that can be the difference between someone living or dying, okay?
We had Maggie Miller here yesterday,
Oh, yes,
and she was talking about some calls in Illinois can take 30 minutes.
yep, exactly, okay? So, it's always good, so out of anything, you know, I think, do you guys offer CPR? I think so. There's a core. Yeah, we offer CPR here. The community offers CPR, SCC offers CPR. That's a good starter to see if it's something you want to go into, because that will give you your basic on how to save a life with rescue breaths, okay? I always encourage all families, you know, when they have kids too, to train the kids to know CPR in case something happens, okay? Have a plan. Does anybody have any questions about the paramedic program? You might have calls at night, okay, that you go on. They do a rotation. It's also during the day, okay? And so students do tend to be able to work some in the paramedic program compared to other health programs. But it is a full-time, it's a full-time going to school, okay? But it goes so fast. And you think maybe, I know sometimes in high school I thought 2 years was a long time, but really for a career to make really good, decent money, it's really not. It's a short time, and you're not just sitting in a classroom for 2 years. You're up, you're moving around, you're actually working on realistic scenarios. Get a cool uniform, okay? So we have a red polo and then also a gray polo that you get to wear. And then eventually you'd have your full gear and shoes, and paramedics carry a lot of things. They carry scissors, they carry all sorts of pin lights, and so it's really neat to see you geared up head to toe. So, any questions? No? Did we answered all your questions on paper today? Cool. Right. Will y'all come out and see me and see our simulators and our robots and our ambulance sometime? Okay. Please try to make the health expo. Again, I'll make sure that your instructor has that and that you sign up. You get to go. It's free to you. Okay. We're hoping to have the helicopter there that day too. So we not only will have the ambulance service there, but we'll have the helicopter hopefully there will land as well. So it'll be a pretty cool, fun event for you, and it's free. So my last bit is always look into your options. Okay. Look into your options. Okay. When I went to college, we didn't have the resources that you guys have now, okay? You guys really have so many resources. We didn't have a recruiter, okay? We didn't have extra scholarships and funding so you go free, okay? My job is to help you figure out what you want to do and then help you connect your goals and dreams, okay? And so even if it's not with SCC, you can start with SCC and transfer on, okay? I highly recommend that. I went the other route. I went straight to university and I'm gonna pay my student loans for a very long time. I could have had that debt be a quarter, not just cut in half, a quarter of debt if I started at a community college, then transferred, okay? We have a new student athletic center at SCC right now, okay? So we have all these new buildings, so if you haven't been out there in a while, I encourage you to come see it. Dr. Ash has been really good about building all sorts of cool things, fun activities, event centers, and it's all free for you, okay? And so please come out and see our facilities and check them out sometime. You're more than welcome, okay? How are we doing? Okay, we're doing it? Okay.
Yes.
Thank you, everybody. I really appreciate it. Thank you for having me, and I hope to see you soon, okay? Thank you, big mom. Good job on the rescue breath.